Welcome back to the Sleep Easy Cognitive Behavioral Therapy for Insomnia series. In this second video, we will explore the causes of insomnia and how cognitive therapy, the C in CBT, can help. Hi, I'm Wendy, and I'll be your guide through this program. Let's start by defining insomnia. It is a condition in which a person has difficulty falling asleep, staying asleep, waking up too early, or a combination of these. Acute insomnia occurs when these sleep problems have been present for only a few days or a couple of weeks, often triggered by a stressful event in your life. On the other hand, chronic insomnia is when sleep difficulties persist for weeks, months, or even years. Here's a quick trivia question for you. What percentage of people struggle with chronic insomnia? Is it 10%, 20%, 30%, 40%? Or, I'm the only one? While it may feel like you're alone in your struggle, the reality is that 30 to 40% of people experience chronic insomnia, at least intermittently, and 20% struggle with sleep problems on a regular or nightly basis. So if you're struggling with insomnia, remember that you're not alone. Each person has a natural level of arousal intensity, represented by the blue bar. Factors include age, gender, and genetic factors. Some individuals have a lower bar, while others have a higher one. The higher the bar, the greater the risk of crossing the insomnia threshold and developing clinical insomnia. When a person experiences a stressful event, precipitating factors push their arousal bar above the threshold, resulting in acute insomnia. Stressful events may be negative, such as losing a job, or positive, such as having a new baby. After the stress decreases, the acute insomnia should resolve. However, many people develop unhealthy sleep habits and lose confidence in their ability to sleep, leading to perpetuating factors that keep them above the threshold. This can result in chronic insomnia that lasts for years. The most common course of action for individuals with chronic insomnia is to take medication to promote sleep, such as over-the-counter medicines like NyQuil or prescription drugs like Ambien. These medications raise the insomnia threshold above the arousal bar, improving sleep. However, over time, individuals may develop tolerance to the medication. In other words, their brain gets used to the drug, the insomnia threshold gradually decreases, and the insomnia returns or worsens. Increasing the dosage or trying new medications may result in partial relief, but they usually don't provide a lasting solution. Research shows that cognitive behavioral therapy, CBT, is the most effective treatment for chronic insomnia because it eliminates the perpetuating factors that keep the condition going. Unlike drugs, which only cover up the symptoms, CBT addresses the underlying causes of your sleep problem, potentially curing your insomnia. So what are these perpetuating factors? They include maladaptive sleep behaviors. These habits include spending too much time in bed awake, trying too hard to fall asleep, and looking at digital devices during the night. Having inconsistent sleep and wake times can also disrupt your body's natural sleep-wake cycle. Sometimes taking naps during the day can make it harder to fall asleep at night. It's common to turn to caffeine to feel less tired or alcohol to help you fall asleep, but both can negatively affect your ability to sleep well. Cognitive and emotional factors can also perpetuate insomnia. When you have trouble sleeping, you may worry too much about it, which can make you anxious and make it harder to fall asleep. You might also think that you need more sleep than you actually do, which can lead to feeling frustrated and disappointed. These negative emotions can make you focus too much on your sleep problems, which can make your sleep worse. If you are suffering from insomnia, do you ever have the following thoughts?
It's going to be another bad night. I'm scared I won't be able to fall back asleep. If I don't get my 6 hours, I won't be able to function.
Bad sleep is destroying my life. How come my husband or my wife can sleep while I'm struggling? I really need that sleeping pill, otherwise I can't sleep.
The first step in curing your insomnia is to change your beliefs by filling your mind with positive thoughts about sleep. You need to believe that your sleep will improve. Let's do an exercise together. Grab a journal or piece of paper. Reflect and write down any negative thoughts you have about your sleep. Then convert those negative thoughts into positive ones and write them down. You can refer to the statements on the screen if that helps. Go ahead and pause the video now to complete this exercise. I'll be right here when you're ready to continue. Welcome back. I hope the exercise was helpful. Place the paper with your positive thoughts somewhere you can see it, often as a reminder. Always be aware of when you're having negative thoughts, and instead, intentionally focus on positive ones. Even if you don't feel positive, your attitude and beliefs can be influenced by your words, whether you say them out loud or silently. As you apply cognitive behavioral therapy, CBT, believe that it can work. Remember Robert and Sarah from Video 1. Their insomnia was cured, just like many others who have gone through this program. You can be one of them if you intentionally apply the techniques. When you're ready, continue to Video 3, where we will optimize your sleep hygiene and build the foundation for good sleep. See you in the next video.